shaking.
Thank you. Oh, well, thank you so much, everybody. It is wonderful to be here. Thank you to UNLV for helping to sponsor this. Thanks to CAP for the outstanding work you do. But most of all, thanks to SEIU. I've got a history with this union. When I was a young organizer that had just moved to Chicago, I started working with SEIU Local 880, home health care workers, to make sure that they were registered to vote and had a say in the politics in Illinois. When I went to the state legislature, I worked with Tom Balanoff and SEIU to make sure that children who didn't have health care received it, and we made sure that hospitals had to report on the quality of care and the staffing ratios that they had set up, and now we're working together at the federal level to make sure that all Americans, and not just some Americans, are allowed to prosper. But the thing that I appreciate most about SEIU and Andy Stern and Anna Berger is you guys recognize that the world is not standing still. And we've got to take the values that have made America great, and we have to adapt them to new times. And we know what those challenges are. Because of globalization, because of automation, what we're seeing is increasingly a situation in which the benefits of this new economy accrue to just some and leave too many behind. Wages, salaries have flatlined, and benefits are diminished. And the message that we've heard over the last 6 years is you're on your own. The troubles, the difficulties, the burdens of globalization are going to be placed on the backs of workers. But there's always been another vision that says we're in it together, and that the burdens and benefits of this new economy have to be spread evenly across the economy. And nowhere do we see that more than in the issue of health care. Everybody here knows the statistics. We as a nation spend $2 trillion every year, more than any nation on earth, and yet we still have 47 million people who are uninsured, 9 million children who are uninsured. We've got families who are being bankrupted as a consequence of rising costs, and we've got businesses that are being rendered uncompetitive because of these rising costs. Now, everybody on this stage is going to have a plan to move this health care debate forward. I will be putting out a plan over the next couple of months that details how I would approach the basic principle that by the end of the next president's first term, by the end of my first term, that we are going to have universal health care for every single American in the United States. And there are going to be some basic principles: that coverage has to be universal, that we're going to have to save costs and get more bang for our health care dollar, that employers, government, and individuals are all going to have to put up something, and that savings that we obtain from making a more efficient system can't be just obtained by hitting frontline workers. But in addition to those basic principles, what I think is most important is we recognize that every 4 years we hear somebody's got a health care plan. Every 4 years somebody trots out a white paper, they post it on the web. But the question we have to challenge ourselves is, do we have the political will and the sense of urgency to actually get it done? I want to be held accountable for getting it done. I will judge my first term as president based on the fact on whether we have delivered the kind of health care that every American deserves and that our system can afford. And I'm not going to be able to do it on my own, so I hope that SEIU ends up being a partner in that process. Thanks, everybody.
Thank you, Senator. You gave a speech in January where you said that the time for half steps and the time for half measures in health care is over with.
Right.
But thus far, we haven't seen a plan from you yet. And so I'm going to turn my first question over to Morgan Miller, who went on your website looking for some specific answers and didn't find them. So I'm going to give him a chance to ask you those specific questions now.
Right.
Morgan?
Where's Morgan? Is Morgan over here? Hi, Morgan.
Hi, as many young Americans, I went on your website to find
Right.
some information about you, and all I saw when it came to addressing the healthcare issue was things like HIV, which is very important, and issues like lead poisoning. And so I was wondering, what really are your top issues when you want to talk about healthcare? Are you going to address the pharmaceutical companies? Are you going to address the insurance companies? Because it's not online.
Right. Well, keep in mind that our campaign now is, I think, a little over 8 weeks old. And so we will be putting a very detailed plan on our website. One thing I want to make sure of is that I'm not sure whether you're going to the campaign website or my Senate website. So we haven't transitioned all that information from our Senate website over to the campaign website. But as I indicated before, my commitment is to make sure that we've got universal health care for all Americans by the end of my first term as president. There are some basic principles that this plan will have. Number one, we're going to have to make sure that everybody's in. Number two, we've got to make sure that we apply some principles that I think every expert agrees to in terms of how we save money and get more out of the dollars that we're already spending. For example, we've got to put more money in prevention. It makes no sense for children to be going to the emergency room for treatable ailments like asthma. And if we are giving them regular checkups with their primary care physician, then we're going to save money in the system. 20% of our patients who have chronic illnesses account for 80% of the costs. And so it's absolutely critical that we invest in managing those with chronic illnesses like diabetes. If we, for example, hire a case manager to work with them to ensure that they're taking the proper treatments, then potentially we're not going to have to spend the $30,000 on a leg amputation if they're diabetic. Applications of medical technology can not only reduce administrative costs, but can also improve quality and reduce medical errors. And we're going to have to take those savings and apply them to those persons who can't afford health insurance so that they can buy into the system, so that we're subsidizing them in some fashion. Another principle is that it's going to have to be some form of pooling of costs and risk. And there are going to be a number of proposals that are out there. I heard in some of the previous questions that one pool would be the federal pool that already exists for myself and other federal workers. Some states like California and Massachusetts are already starting to set up their pools. Whatever the mechanism, we're going to have a pooling system so that individuals have the benefits of being part of a larger group. And the final thing that I'll just mention is that we're going to have to do something serious about quality and how we spend our money. Not only do we have to put more money in prevention, but we've also got to make sure that, for example, if a generic works just as well as a brand name drug, that we're not allowing drug companies to dictate what is on the formulary, what drugs are available under a plan, but we make sure that the money is spent on the most efficient drug for that particular disease. If we do all those things, I believe that there's no reason why we can't end up with the kind of healthcare system that would ensure that every American has high-quality basic healthcare. Now, I promise you that this will all be on the website. If we have another form in a couple of months and it's still not there, I expect it to show up again, Morgan, and I'll be in trouble.
But